Okay, guys, we're going to try something a little bit different here. We haven't done before. This is probably just an easier way for me to go through for your study guide for quiz, the ultrasound or the sound and light quiz for next week. So we're going to do this in kind of virtual format, and I'm just going to use the information on the PowerPoint slides here and go through what the most important things are as I look down your quiz for next week. So we'll give this a shot and see. It's just more time efficient for me to go ahead and explain this to you guys, and you can just write down what the most important things are that we discuss here. So I am looking at your quiz, and I'm going to start with the ultrasound PowerPoint. Like always, most of your stuff is going to be pulled from the PowerPoints, but I'll give you some insight into what the more appropriate things are for moving into your quiz for next week. So as I look at this ultrasound, you guys already know. I really need you to know the main conversions here. Not so much this. I want you guys to know that there are different absorption rates or absorption coefficients for different things. So pay attention to this. You're going to see this situationally. So you're going to have to probably explain to me why you need to use caution when you're performing ultrasound over certain things as opposed to other things. I also want you to be able to tell me these are the most important parts. So we have it here in his documentation, but I really want you to understand the differences between the intensity, the frequency, the duty cycle, and how all those come into play in terms of when you're delivering ultrasound, what are the parameters that are most important that you're considering the most. The other part of it too is just having a healthy respect for what the effective radiating area is. That's the ERA. I couldn't remember the name of it on last week's class, but yes, the effective radiating area, which is like that transducer side. I'll bring up the slide in a second, and then the beam non-uniformity ratio. So a lot of your questions are going to have to do with this right here. So like we discussed, 3 megahertz ultrasound versus 1 megahertz ultrasound. What are the potential benefits and the differences between why we might use a 3 compared to using a 1? And the big one we talked about is depth, right? So in frequency, you're thinking about depth. Are we going deeper, trying to penetrate that 3 to 5 centimeters? Or are we trying to go maybe a little bit shallow around our bony prominence where we might use a 3 megahertz ultrasound? So there's a good indication of that. Review those slides. Great picture for that as well. So review that. The other part of this is a lot of the questions are going to have to do with ultrasound duty cycle. So the big thing we talk about with duty cycle is it's essentially it's an expression of on and off time. So when we see a duty cycle of 20%, it's a ratio of the transducer head being on versus it being off. And how do we manipulate the duty cycle in order to achieve different treatment goals, right? So at a duty cycle of 100, what you should be thinking of is continuous and thermal effects. At a duty cycle of 50% or 20%, which is going to be your pulse duty cycle or pulsed ultrasound, you're thinking tissue healing, maybe disruption of stagnant blood for like a contusion, but things like this. So understanding when you're going to use each one of those and how you manipulate those two is going to be huge. There's just a picture of that, 20%. Just come back to your PowerPoint for that. And then same deal here. How do we adjust the intensity? So the intensity is going to be used specifically to address the other parameters that you've already chosen. So when we talk about where intensity is more important, we're thinking it's mostly important when we're using 100% duty cycle. And then the distinctions we've already made in class, which are if I'm going at that 3 megahertz cycle, so I'm working around a shallow structure, the ultrasound itself is not going to penetrate as deeply, but it will heat faster. So as a result, we need to decrease the intensity, right, to accommodate for that fast rise in temperature. So you're thinking about a 0.5 megahertz, correct? And then when you're looking at trying to penetrate more deeply with a 1 megahertz ultrasound to get a bigger structure like in a beefy quad, we're going to try and increase the intensity to maybe a 1.5, a 2 watts per centimeter squared, just so that we can get a little more depth out of the treatment. And as you guys saw with Professor Powell, like this really does work. If we go too deep, too far, and you hit that bone, you can start to rattle things around in there. It becomes very uncomfortable. So in a weird way, it was kind of good to see that. Let me take another look here. I'm going to roll back down. I want you guys to know the ERA. It's fairly simple concept, right? You've got the transducer face, and the ERA is just the area within that face that is actually conducting and radiating that ultrasound energy, right? Same deal with the BNR, right? B non-uniformity ratio. So again, we said it's a fancy way of trying to say that really the higher intensity, here it is right here, what we call the spatial peak intensity is going to be right over the dead center aspect of that transducer head. And you can see that here, right? Dead center, we're going to get that spatial peak intensity. And then as you navigate outward towards the outer diameter of the transducer head, you're going to start to have a decrease in the intensity. So we have to remember that this is important mostly because it's going to affect when we use the size of our transducer head, right? So a smaller transducer head is going to have a higher B non-uniformity ratio because it's more condensed compared to like the difference we had like on our machine, like a 2 centimeter versus a 5 centimeter. So just understand how BNR works when we're applying ultrasound functionally. Let's see here. You guys know continuous. You know you have to keep the sound head moving. Understand why it's important to keep the sound head moving. Okay, what we're trying to prevent because of that cavitation microstreaming and the fact that you're delivering a continuous standing wave. So if you focus that standing wave in one place for too long, you have like what happened with Professor Powell, where it starts to focus that energy so directly in a place that it can start to vibrate internal tissues that have that high acoustic or acoustic absorption rate. So you have to pay attention to that. Not so much here. This is the really great one that I like. You guys should be seeing this in every. It's a perfect representation of the difference between 3 megahertz and 1 megahertz, right? So study this and put it in your brain so that you have it when you come to the class. I'm going to go ahead and just put this as a catch-all for everything that we've done so far. And I know that we sort of segmented away from certain things like laser that don't get used as readily. I do want you guys to 100% know all the pertinent clinical indications for all the modalities we reviewed, regardless of whether we spent time on it or not. And you guys need to know all the contraindications and precautions, and definitely be able to distinguish between what's a contraindication and what's a precaution, okay? Because you might get a question that says, I don't know, you've got 2 stupid answers, then you've got one that's a contraindication and one that's a precaution, but the question is asking you for a contraindication. So be able to tell the difference between each one of those for all the modalities, not just the ultrasound that we talked about, for all the modalities we've covered so far. All right, I think we're doing pretty good here. Let's take a look. Application technique for sure. Definitely want the indications, definitely want the contraindications, and adverse effects, right? What are things that could happen if we don't appropriately utilize the intervention as it should be used? All of those, same holds true for everything we've talked about, from laser to diathermy to UV. And knowing not just the indications, but knowing the indications for, ooh, that's nasty, knowing the indications for why you're going to use certain parameters over others, right? So I'm going to be heating tissue if I'm using continuous at 1 megahertz, right? I'm going to be looking for that treatment healing or that wound healing or just tissue healing aspect if I'm going with a pulsed ultrasound. So I might use that in acute versus chronic. How do all these play together? You have to have a fundamental understanding of how that's all going to work and what the entire package of ultrasound has at your disposal. And when you see yourself in a clinical situation or a question on the quiz, I need you to be able to use that insight to make a clinical determination. This is the other thing too that you'll see, like we talked about. I'm going to amend this based off of what I'm seeing out of the Score Builders book. But again, the area to be treated depends on the ERA and the duration of treatment. Just know that there's a correlation between the ERA and the size of the area that you're treating and the duration, and it's directly correlated, right? So the bigger the area, the bigger the ERA, the longer the treatment's going to last. And for areas that are larger than 4 times the treatment area, we're going to go ahead and say, based on Score Builders, that we would probably rather select a different modality other than ultrasound, because nobody can do an ultrasound for 25 or 30 minutes, right? So to a huge area, it's just not as efficient. Also, one thing that I need you guys to know, we're going to start to tie in documentation, because I'm seeing a lot of the, as we talk about SOAP notes, and you guys are doing pretty well, but it's just to shore up that knowledge of the SOAP notes. Understand what's important to document with all of these. So know that the parameters are always the most important thing to document, and then it's sort of descending order. It's like, okay, I need to know the parameters, and then things like what position the patient was in, but just be able to discern the level, the hierarchy, like the totem pole for what's the most important thing. For like an ultrasound, you're always going to have duration, you're always going to have your frequency, your intensity, and your duty cycle. Those are always going to be listed because when somebody comes behind you, they're going to have to be able to replicate what you did that treatment, and they have to use it and do it the same way that you did in order to get the intended benefit. What might not be as important is like patient position. Is it important? Yeah. Is it as important as noting the intensity and the specific parameters you put down? No. And the last one we're going to use here is, this is a super chart. Please look at this chart because it's going to give you so much insight into making those determinations about why you would use what you would use. So I won't go into explaining it too much, but just really and truly take a look at this thing and own this chart. I want this thing to pop up in your mind's eye every time that you're thinking about how to use ultrasound because it's a super terrific chart. All right, that looks good. Let me take another look here at what else I can add. Okay, so I'm going to do just a really quick one on ultraviolet. Again, not so big, not worried about necessarily the super science behind it, but understanding that when you're using modalities like ultraviolet, it's important to notate the frequency, the wavelength. I'm not expecting that you guys understand these 100%, but if you're documenting this stuff, I want to know that you understand that these are the important parts that need to be documented. Is anything specific that has a numerical value is always going to be important to add into your documentation. Same deal like we talked about. Here's the effects of UV. This is stuff you might see with UV. Again, clinical indications. So understanding that psoriasis is a big one. We talked about that tends to fall in the world of dermatology, but knowing that UV is mostly used for psoriasis and for wound healing, even though there's not a whole lot of research supporting it, but just understand the uses, contraindications, precautions, adverse side effects. You guys should get this by now, right? Just know these slides, if nothing else. Also, trying to get to UV, you could add just an increase in vitamin D production. Just go down the list and be able to cite back to me. If I give you a question like when you're using certain types of diathermy, what might be a positive benefit of using, not diathermy, but UV, diathermy, whatever it is. And that's pretty much it for UV, so we don't really need to go too far down the rabbit hole on that one. Diathermy we'll use, I would understand how the two types of diathermy, the fact that there are two different sort of intended effects in terms of deep heating versus non-thermal effects for controlling pain and edema and all that. Always contraindications, always precautions, the types of applicators that you can use, especially with precautions, where we use this part right here with like obesity, which was kind of weird. Understanding why obesity is not a contraindication, but a precaution, is because of that absorption rate, right? When we have heat transfer, certain tissues absorb heat better or worse or the same than others. Adipose tissue or subcutaneous tissue tends to has a higher what's called specific heat. So it heats up faster than other tissues might. So if someone has a lot of adipose tissue, you need to know that would be a potential precaution because those tissues are going to heat up faster than other tissues. So that goes back to your chart that you saw kind of with ultrasound, right? So just make sure you study that quite a bit. Let me look through here. There's our funky stuff. There it is. Fat is the greatest risk for burning. So same deal. Understand your positioning and know how to document like everything else. Just know what the frequency range is. I don't expect you to have specific information, but just know when you document what is most important. Other than that, I think that's pretty good for diathermy. Again, it's mostly, guys, indication, contraindications, and potential benefits or adverse side effects. And then we can just wrap it up. Laser light. Didn't do a whole lot here. Tends to be more in terms of how you're going to document this because we don't really use a whole lot of laser, and I'm not going to put a whole lot on here. Like I said, it's mostly going to be ultrasound for this one. It's like broken record, right? Contraindications, precautions, adverse side effects, how you apply the technique, You can understand maybe this chart is good to read just in order to have an idea of some of the potential things that you can use laser for. And then for sure the documentation, right? So just what you're going to notate when you're using laser in terms of the specific parameters. And other than that, let me just take a quick look over here. Okay, so outside of that, I think you should be pretty well squared away for the quiz forthcoming. The one thing I am going to ask you guys to do is some of these, you know the basics, but some of these questions are going to be board questions. So the way they're going to present to you is sort of, it's going to give you a clinical scenario, and you're going to have to decide what parameters are most appropriate, and or you're going to have some anatomical information. So go back and review. I'll give you a hint. One on the ankle, one on the shoulder complex, let's say. You have to know what certain anatomical structures, bony landmarks that you're going to be dealing with, where certain tendons might lie. So just be able to discern that. But also making a clinical determination in terms of if you're having an adverse reaction from a patient, what do you need to do, right? Are we stopping treatment? Are we taking them to the ER? Are we just saying that's normal? So you're gonna have a list of answers that all will sound fairly relevant. I want you to pick out the appropriate answer with regard to the safety of the patient. That should pretty much do it, y'all, for this quiz. I think it should be pretty straightforward. Obviously, if you have any questions over the weekend, you can email me. I'll be happy to get back to you, just answer any things that you might need. So we'll try this like this in terms of study guide. Again, this works better for me, so I'm going to just try and use this moving forward as a way to communicate what I'm looking for certain assignments or certain quizzes and study guides. So hopefully this is good. Enjoy the weekend, y'all, and I will see you next week. If I can turn my mouse off. Oh yeah, there we go. Bye.